Good afternoon. I'm pleased to present my summer work for the Human Rights Fellowship entitled Oral Health Disparities Among Children in San Francisco Chinatown, a Community-Based Approach. As a dental hygienist for the past 10 years, this project is very important to me in my mission to promote oral health to underserved communities. My journey began while here at Berkeley. I took a great class with Eric Stover and Rohini Har entitled Health and Human Rights. It seemed while health was considered a basic human right, oral health was neglected. The World Health Organization defines oral health as a state of being free from pain. Oral and throat cancer, oral infection, sores, periodontal disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial well-being. Indeed, poor oral health can have detrimental effects on overall health and can negatively impact quality of life. Poor oral health has been linked to multiple systemic diseases, including diabetes and heart disease. Tooth decay is a major public health challenge. In fact, of the 291 diseases that were included in the Global Burden of Disease study, it was the most prevalent and the most widespread condition. Dental caries in children is the most common childhood disease. It is 5 times more common than asthma, 4 times more common than early childhood obesity, 20 times more common than diabetes. Untreated tooth decay in children can cause mouth pain, missed days of school, difficulty concentrating, eating, and sleeping. It is still difficult for me to look at these images of early childhood caries. This is an infectious disease. It begins as the teeth first emerge, and it progresses rapidly. Multiple factors contribute to this condition, and these are largely preventable through education, through nutritional counseling, and through access to care. This disease disproportionately affects children who are minorities and who are living in poverty. The San Francisco Children's Oral Health Strategic Plan was a joint effort between the Public Health Department, UCSF, University of the Pacific, and several community organizations to address children's oral health in San Francisco with the goal of making children caries-free. It is an interdisciplinary effort to reduce disparities in oral health, to reduce disparities in access to care, and to implement targeted upstream prevention in the community. In San Francisco, 40% of children in low-income schools experience caries. Untreated caries are 2 to 3 times more prevalent in children of color. And while overall prevalence has decreased in higher income schools, it is actually increasing in lower income schools. The highest burden of caries is experienced by children in San Francisco's Chinatown neighborhood. Our objective was to seek to understand this disparity in order to guide interventions by going upstream to caregivers with young children, to investigate the real and perceived barriers to accessing care, their attitudes about oral health, and about oral health care providers. Caregivers will be given a survey to assess basic questions, yes/no questions, and demographics. We will continue the conversation through an interactive focus group with caregivers of young children. I have found only one study of this type and only one oral health disparities model. A good model must consider the complex web of factors that contributes to this condition, from the macro level, the organization and delivery of services, to the community, the social and cultural factors, and finally to the individual factors, such as health behaviors. Various areas of inquiry were fitted to our model. Through a collaborative effort, we have worked to design an instrument. This project is ongoing, and in order to work within the existing structure of our community, of this community, we are going to work with the task force in Chinatown to finalize the study design and to make sure that our questions are culturally appropriate. In order to get to know the community and to give back to those who I hope to help, I volunteered at a dental screening in Chinatown. We screened and referred over 1,000 community members, and it was a wonderful experience. I would like to thank my collaborators, Jody Stuckey with the Public Health Department and Christine Miller with University of the Pacific. I would also like to thank Dr. White and the Human Rights Center, especially Julie Lagarde and Andrea Lampos. Thank you.